Hi, my name is Shruthi Kanmanta. I'm a student nurse. Today I'm going to do some presentation on Oligohydramnios regarding my maternity assignment. Let's talk more about that. Presentation on Oligohydramnios. What is oligohydramnios? Having less than 300 ml of amniotic fluid is known as oligohydramnios. Amniotic fluid is the warm and cushion-like fluid that protects, supports the baby as they grow in the mother womb. The volume of amniotic fluid is as important factor in assessing fetal well-being. This fluid also contains immune system cells, hormones, nutrients, and baby's urine. This information I found in our Paris Maternal and Child 5th edition textbook. Expected assessment. What are the expected assessment for a patient with amniotic fluid deficiency? It can also occur because the patient amniotic membrane has ruptured and it is leaking outside of mother's womb. What leaking fluid is the first important sign for amniotic deficiency. Not feeling the baby's movement is also a very important sign for amniotic fluid deficiency. Small measurements for mother womb. When mother come for regular checkups, we need to measure the womb and it should be increasing every checkup. A sudden drop in the fetal heart rate is not at all a good sign for the amniotic fluid deficiency. And we have to tell the mother that count for baby's movement and kicks. It is otherwise it's a not good sign. What are the identifications? Routinely ultrasound will also give an indication of proper fetal development and amniotic fluid development. This information I found in our Alberta Health Service website. And expected assessment I found in our maternity textbook. It was in the 5th edition. Potential complications. What are the potential complications when we see the patient with amniotic fluid deficiency? Lack of amniotic fluid, that fetal movement and breathing are defect because the amniotic fluid supports fetal breathing and motor movements. According to Paris Maternal and Child 5th edition textbook, the fetal kidney is the most common cause due to the lack of fetal urine. Lack of amniotic fluid during the first and second trimester can cause complications. What are the complications we find in first and second trimester? Breathing defect, miscarriages, premature birth, stillbirth, according to the Healthline website. During the third trimester, low level of amniotic fluid can cause difficulty breathing during labor, such as squeezing the umbilical cord, which can affect the baby's ability to get oxygen, increase risk for cesarean delivery and the slowed growth. What are the appropriate nursing care for the low amniotic fluid deficiency patients? Monitoring maternal and fetal closely, including the vital signs, fetal heart rate pattern, and as well as the weight gain pattern. This information I found in our maternity textbook, 5th edition textbook. Fluid therapy. Increasing the patient fluid intake may help increasing the amount of amniotic fluid. Oral hydration is usually advisable for the patients. That is according to the Pravara Medical Review research article. And according to our maternity and child 5th edition textbook, amino infusion, which involves infusing of saline solution into mother womb. So, patient and family education for amniotic fluid deficiency. According to Pravara Medical Review, it's a PIPS research article went in 2022. Oral hydration with water significantly increase the amniotic fluid volume in 4 hours. So we need to suggest the patient to take a lot of fluids so that it can temporarily increase the amniotic fluid. And according to Alberta Health Services, teach patient how to count the baby kicks and track fetal movements. Stress the value of quitting smoke because it can lower fetal blood flow and cause hypoxia, which can result in reduced fetal renal blood flow and oligohydramnios. So it's not only about the amniotic fluid deficiency patients, it's for every mother, whoever wants to get pregnant. It is better to suggest them and advise them to quit the smoking because smoking can lower the fetal blood flow and cause hypoxia. In conclusion, oligohydramnios is a potential serious condition that can cause complication during pregnancy and affects the baby growth. Low amniotic fluid can be serious in most cases, but it is treatable, so never worry about that. And always take advices from the healthcare professionals. The babies can born healthy and happy if the interdisciplinary team monitor closely and collaborate with the patient to determine the safe treatment plan. The patient should attend all the parental visits and increase fluid intake so we can have a healthy and happy baby. So these are my references where I found all my notes for amniotic fluid deficiency. Let's do some quiz now.